You mentioned Apple a couple of times, and hearing Aaron speak about wearables, it reminded me that a part of their really big strategy in moving the Apple Watch was a strong focus, a strong pivot to health. And I wonder if you think that a pivot to health for the VR space would be maybe the gateway to get more people in the door.
So I think a few things. It isn't so much, I think, health as a lever necessarily to drive a platform shift here as much as we're talking about calibrating dials, if you will. And I think as with any device that Apple brings to market, it should be considered in the broader kind of product suite, if you will, and how that plays with the Apple Watch and the AirPods, which all of which increasingly have health-based applications. I think it's things like the available app install base or price point are some bottlenecks. One theory I tend to talk a lot about with investors is this idea of utility for consumers. So a lot of consumer applications broadly can gain traction when you save people time or money. And I think there's utility in the wearables VR XR space in the sense that the tool can be a better fit for the job, so to speak. So when we think about like PTSD treatment, for example, or anxiety and depression, having a more immersive experience can be helpful in combating some of those symptoms. So again, I wouldn't think about it so much as like necessarily the core lever as much as it's kind of, again, a way to calibrate utility in some respects.